Welcome back, everyone. Better health now. It's a reaction that can be triggered by allergies affecting 60 to 80% of kids and about half of all adults. Asthma. Joining us from Allergy and Immunology Associates of New England is Dr. David Robertson to tell us more about that and treatments that are available to help. Doctor, good to see you again.
Thanks for having me.
So what is the link between allergies and asthma?
Sure. Asthma is a problem in the lungs where old air gets trapped and the new fresh air with oxygen in it can't get back in. For a lot of people, there's 3 different components to asthma. The first is inflammation in the lungs. The second is spasm of the muscles on the outside of the lungs. And then the third, and this is where allergies come in, is airway hyperresponsiveness. And that's a fancy way of saying that if a person with asthma and without asthma are exposed to the exact same thing, the person with asthma is going to have more symptoms. Now that could be something like cold weather. It could be walking through a cloud of dust. We actually see this a lot with kids.
Yeah.
Sometimes it can just be a cold. You get a cold and a person without asthma coughs while they're sick, and a person with asthma coughs for 2 or 3 months.
No kidding.
No kidding.
That long. And just in case people are maybe confused or don't know exactly what asthma is, I do suffer from asthma, and it feels like there's a pressure on your chest. You just can't breathe. And if it becomes, a real emergency, that's when you need the inhaler that I use, albuterol, I think it's called.
That's exactly right. So the common symptoms associated with asthma would be wheezing, chest tightness, and again, sometimes just like that lingering, nagging, dry cough that won't go away. Albuterol is a very commonly used rescue medicine.
Inhaler.
That's right. So what it does, the albuterol triggers the spasm component, so it helps the muscles in the lungs relax and open up so you can breathe again. But it doesn't do anything to treat the inflammation in the lungs. So some people only have asthma every once in a while, and that's called intermittent asthma.
Okay.
But some people have a significant degree of inflammation in their lungs on a regular basis, and they need to be on a daily medicine to help control their symptoms. And usually those are inhalers like an inhaled steroid.
Something you would take once or twice a day then.
That's exactly right.
Gotcha.
So it's,
And they don't help in an emergency, right? You build it up over time.
That's exactly right. It's kind of like, the exact same medicines that you would use if you had poison ivy.
Okay.
You put hydrocortisone, which is a steroid, on the rash. And so with the inhalers, you're trying to put the medicine where the problem is by breathing that steroid medicine into your lungs and slowly reducing the inflammation. If things get real bad, you might have to go to the ER. They might give you extra albuterol, but they can also give you prednisone. Prednisone works. It's a fantastic medicine for reducing inflammation. In fact, if I gave you prednisone, it would fix your poison ivy, it can help your asthma, it can maybe help if you have arthritis or something.
But I'm sensing a big but here.
There's a big but.
Yeah.
And the big but is the side effects. When you take that medicine by mouth, or if you get a shot of it in your arm, the way that one medicine can fix all these different problems is every different cell in your body gets exposed to it. So it can treat a lot of different problems, but it also can have a lot of side effects. For adults, it can increase your risk of diabetes and osteoporosis and cataracts. And for kids, it can actually interfere with growth. So one of the metrics that national guidelines use to say, is asthma controlled or is it not controlled, is how many times a year do you have to go on prednisone? And if the answer is 2 or more, your asthma is not controlled and you might need a daily medicine.
And you need to control it. So are there different or new treatments out there that are available?
That's exactly right. So as we've kind of alluded to, the 2 main ways that we treat it are with daily inhaled steroids if you have persistent asthma, and then a rescue medicine like albuterol. For people that have allergic asthma, there's another option. So another option is allergy immunotherapy or allergy shots. And so the idea with this is we actually try to get your body used to the things that you're allergic to. So if you're allergic to cats or dogs or dust or pollen, we can actually expose you to small amounts of that and your body becomes used to it over time.
That takes a while though, doesn't it? Or years?
And it's very effective, but we kind of have to get your asthma to a stable place before you can do that. So over the last few years, maybe 4 or 5 years, there have been 5 or 6 new medicines that have come out that are very sophisticated, and what they do is they target specific parts of the immune system that tend to be overactive in asthma, and they're very, very effective. The only real downside with them is that because they're new fancy medicines, they can be very expensive.
And unfortunately, we're out of time right now, but I'd imagine if you want to continue this conversation with someone like you, contact your doctor and find out more about these new allergy and asthma treatment medicines. Thank you so much for your time.
Thank you for having me.
Great information, by the way,
Thank you very
especially
much.
this time of year.